MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Hello, welcome to the MedBix Webcast. This is Raman Annamaraju. I'm the host. No, I'm not Albert Einstein. Maybe my guest is. So we'll talk with her in a minute. But we are going to talk about a little bit of month of June. So I have a very exciting guest. The second guest in the month of June for me. She's going to be coming in soon. But I have lined up quite a bit of a lineup in the month of June. So anyway, today I'm going to interview the doctor from New York Medical College, Dr. Padmini Murthy. She's basically back from neck of my woods in the back home, and her father is one of the famous engineer, Machagunam Viseswaraya. My brother's name is Viseswara Rao. He passed away recently, but he's also engineer. So I used to remember the name used to sound in my family very quite often. She's the granddaughter of Dr. Mochagunam Viseswaraya. Engineering Day was celebrated on his birthday. Can you believe that? I'm going to talk with one of the engineers, technology, and the healthcare combination. This woman, her name is Dr. Padmini Murthy. She is joining us from Westchester, New York, from New York. She's a professor in New York Medical College. She has 30 years of experience. She wrote 4 books. One of the latest book is that technology and global health. They definitely interviewed some of the global. I interviewed a woman from a cancer advocate cancer from South Africa. So we really need to know. And Bill Frist is one of the person, the former senator, PEPFAR. We passed a PEPFAR, a largest funding for the global health. So I'm going to talk with her. She's one of the experts in the global health, Dr. Padmini Murthy. Welcome, Dr. Padmini Murthy. Welcome to the MedBix Webcast.
Thank you so much, Mr. Annamaraju. Thank you. Hi, everyone. Nice to be here. Greetings from New York. It's actually good evening. It's 9:03. Thank you so much for having me.
You have a long resume, Dr. Murthy. Can you give us a little bit background of yours? Whatever the background that, your professional background and a little bit of personal, whatever you can.
Yeah. So, thank you so much. I guess I'm Indian American, and I traveled a lot before moving to the US more than 25 years ago. And I've always been very interested in advocacy, and I would credit my mother and father for installing that in me and my sister, especially my mother, who always told us to, think about others who were lesser fortunate. And I worked in quite a few countries, and for me, my passion is advocacy and women's health and what we can do. So I try to, in my work, bring about the lens between clinical medicine and public health, and and also advocates. And I feel a lot of us, especially physicians who are working in global health, are really global health diplomats, because we are trying to do make changes in policy, give policy recommendations so that changes are made in policy. And also, as I always tell my students, local efforts can produce a global outreach. And my hobbies are, I love traveling with my daughter, and we've seen 6 continents. The only thing on our list is Antarctica. And I do yoga every day. I love reading. And going for long walks in the summer, especially where we live in Hudson Valley, doing the trails. And another note is I do like cooking whenever I have the time. I'm vegetarian, and I like to try different fusion foods. And and I just came back from 3 weeks in Europe. I was in Italy for the C7 conference and went on to Geneva for the WHO. So Italy is a great place for vegetarians. So it was really interesting. So over to you, Mr. Annamaraju.
Okay, very good. You gave a great description of your entire background. Let us talk about the global health. First thing come across everybody's mind is a woman's health. When you talk about global health, particularly, I was doing a lot of research and I did some background, not like yours, but South Sudan is one of the highest maternal mortality rate in the world. So tell us a little bit about the maternal health across the globe, and also if you can give a couple of sentences about couple of minutes about India and then Africa, and which is and then other countries like Muslim countries. What are the challenges you face in the maternal health?
Yeah, thank you so much for the question. Unfortunately, even in this day and age, we are in 2024 June. We have more than 250,000 women approximately dying in childbirth each year. And as I always say, there is no cure for maternal mortality, but to a great extent, maternal mortality and morbidity are preventable. One of the major challenges we have is there is no prioritization in most of the world for women's health, Mr. Annam Raju. And this translates into really a lot of inequalities. And people need to understand, by people, I mean whether they're policymakers or, the private sector, public sector, all of us, that women's health cannot be isolated from societal wealth. Now, if we look at the 2030 agenda of the United Nations, it's leave no one behind. We cannot hope to achieve this or any of the targets of even SDG 3, which is good health and well being for all at all ages, if we neglect women. So, some of the causes, women's health, some of the causes are inequities, lack of prioritization, lack of literacy, health literacy, and the traditional gender norms. So, these are some of the issues. And the other thing is, unfortunately, women's health is not prioritized, and women have different health needs across the ages. And that is not taken into consideration. To answer your question, for example, coming, because we are from the same part of India, South India, like formerly Andhra Pradesh. Now, for the past few years, it's been split into Andhra and Telangana. But I just wanted to say that when I was a young medical student and doing my OB rotations in Guntur Medical College, it was so sad to see that we often did not have gloves. So what would we do? We would either wash the gloves and use them again, or I have delivered babies using plastic bags. So what I'm trying to say is this lack of funding, the lack of continued importance being given to women's health. And also, women do not have access to contraception. They cannot space their children because they don't have the means or don't have the access. So when I'm talking about, this is just looking at it from a public health viewpoint. This is not a political debate. It's just that women's health is important, and we need men to work with women to address these issues. And I should thank you for having, I've watched some of your podcasts. And I'm not saying it because you invited me to be a guest, but I think you cover very socially relevant issues. And globally, this continues to be a major problem. And the other thing is, due to lack of funding in so many places, maternity wards are closing. So that is another issue. Women don't have access. For example, my students and I spearheaded this project through, working with the former First Lady of Malawi, where we did raise funds to build a maternity waiting home, because Malawi is a very hilly country and women have to walk long distances. They don't have access. So this is what we can do. It's like by working together, working in groups. Like I always tell my students, give up your latte for a day. With that money, we were able to buy safe motherhood kits for women. And another project which I recently just wrapping up with the first lady of Suriname is menstrual equity, where, on behalf of my NGO, American Medical Women's Association, we've been around for 109 years. I'm not 109, but I just want to say we are one of the oldest multi-specialty physician organizations, and we work a lot to promote women's issues, and we focus on the social issues surrounding challenges of women's health, and also what can we do. So we are so happy we could do this with the first lady of Suriname, a menstrual equity project. And then we now there's another project we are working on with which I spearheaded with the first lady of Bahamas, where we are looking at the effects of climate change. So the reason I brought in climate change is because the continuing climate crisis is also affecting women's health, especially maternal health.
You did talk about women have in democratic countries, at least the women have the power to vote, and they can bring a changes in the policy itself because they power of the vote. If they are in democracy, if they are not in democracy, that's a different issue. But still, women's issues are becoming in the front lines of all the media and all the in the elections during elections. So I think there is a play that definitely there's a voice that is coming up now. People like you doing a lot of advocacy. Thank you for complimenting our network. I do the channel. I do propose that quite a bit of work has to be done. Let me ask you. Now you wrote a book on global health and technology.
Hmm.
Now I used to live in the same area as you are from India. uh, that I when I was growing up, my father was a village doctor. He's a teacher and a doctor. And then I remember the day one day, the few blocks from my home, the woman is screaming all night. My father went there and tried to spend a lot of time there. And early morning, the screams I could hear for blocks and blocks, 2 blocks away, I could hear the screams all night. In the morning, the screams are there, they're silent. And my father came back with a grim face, and I asked him, "What's going on?" And she died with ectopic pregnancy because we don't have the resources. Even though he's a doctor, he cannot do a lot of things without the resources. So it was tragic. It has impacted me quite a bit about that. Still, I remember vividly about that. So what? This is a tragedy in the 21st century. That's doing this. A woman, the people who give the lives, giving their lives to the by negligence is a really the lack of resources. So tell us what kind of resources you need. That what kind of the money and what are the other resources you need? Education. Can you give us a little bit background about the resources you need for maternal health?
Thank you for your question. And I can understand why your father was so frustrated, because it happens to a lot of us. You have the skills, but when you don't have the necessary tools and the setting, you can lose a patient. So this is very frustrating. So, what are the resources we need? What we need is, it's simple. We need to have policies which focus on women's health. They need to be intertwined. You cannot have a health policy here and women's health there. It needs to be brought in together. The merger needs to be very clear, watertight. And even at primary care centers anywhere in the world, we need to have trained people, trained birth attendants. A lot of women deliver without trained birth attendants, and gets to be a problem. And also, there need to be facilities, because one of the other things I can tell you is, once when I was in a rural hospital in India, we had a shortage of blood, and this woman had a molar pregnancy. So that means the fetus was dead. It's like a molar pregnancy without going into details, and she was bleeding. We could not save her because we did not have her type of blood. And even though we sent the relatives to get blood, it was too late. So this is the worst thing for any healthcare provider, is to see a patient's life slipping away from you. You can't do anything because you don't have something simple like blood, or you don't have something, like drugs, which to stop bleeding from her uterus, or you don't have a theater where you have to do a cesarean section to save the mother and the child. So we need to have investments in making sure we have women's health. And also we need to make sure in some of the countries, at least in the United States, and some of the other countries, we don't have tetanus to be such a big problem. But in India and some other parts, we do have tetanus. So I'm answering the first question you asked me. So all pregnant women, we advise them to get their tetanus vaccine. So sometimes they don't have access to the vaccine. And if it's a high risk pregnancy, they don't come till it is very late. So there are so many things. And also, one of the other things we need to be aware of is nutrition. A lot of times pregnant women don't get the sufficient nutrition due to so many, like they usually eat at the last. It's the whole gender norm, it's culture. Like everybody in the family eats and then they eat, so they're not so this can cause growth retardation among the babies. It does not, it's not good for the woman. And also even postpartum, they can get infections. That's a major issue we are facing, postpartum infections. And also there is something called postpartum depression, postpartum blues, postpartum psychosis. And then we do not address the mental health of patients because that is taboo. It's
Correct.
not fancy to say somebody has a mental health issue. It's more, what shall I say, like diabetes is a designer disease. People used to think because only rich people get diabetes. In the past that was a notion, but now it's not true, we know that. But it's like, okay, you have money, so you have calories, so you're rich. So unfortunately mental health everywhere is so much of a taboo, especially after a woman has given birth. She can have this where she needs help. So these are a lot of issues we need to address. And the other thing is gender based violence is a major issue. Is that also, the other problem we have is that this whole gender based violence where women are ill treated, they're not given access, they don't have support, they can't talk about it because it's a culture of shame and silence. So there's so many social determinants also which come into play when we're talking about women's health. And it gets a little more complicated when we're talking about pregnant women.
I'm glad you mentioned the mental health. That is actually my cousin. In fact, she died because of postpartum depression. That's a very rare. The first time I witnessed it myself. She is very close to us. I never thought that. While I was living in Atlanta, there is an Indian woman. She jumped from the into the. She took the kids and jumped in front of a train. So it's a very tragic, but that is the one thing we don't pay attention to much. I'm glad you brought that up. Mental health. What are the solutions for that kind of a thing particularly in the global, the developing economies, and in the countries like India and other countries? How do you address that kind of a problem? And awareness is the first thing, right? People is a stigma attached. Can you talk about a little bit about the mental health and the resources we need to put together for?
Yeah, well, because you said about India, I'm just going to focus on India. So, one of the things is I think even the providers who see the women,
Yeah.
just not a trained psychiatrist, need to be made aware and then refer the woman, and also talk to the family to say this is not her fault, because one of the beliefs is they're possessed or there's somebody has done black magic on them. And even now in so many parts, unfortunately in India, even though India has advanced so much, it is still persisting. So it's also socially educating the communities, her family, and also the woman needs to know it's okay to say you're not up to it. It's okay to say you are fed up, you can't do this, you need help. So I think is that is a whole issue. So we really need to make sure we educate the providers too, to look for the warning signs, and even tell the women, like when they come for their checkups, they need to be asked. And especially after the postpartum checkup, also the family members, not to say, she's lazy, she's not interested, in taking care of the baby or feeding the baby, or she's not, she's unkempt. So these are some of the warning signs we need to be aware of. And again, it's not a shame to say, my mood, I am feeling down. So this mental health stigma is there in so many parts of the world, but it's more in some restrictive societies where you have to, zip up, close your lips, just go on like an automatic machine. So this is something, and thank you for sharing that. I'm so sorry this happened to your cousin, but this has happened to so many women. And it really is sad, because with the treatment, we this can be addressed. And the other important thing is, a lot of times women get this when they don't have a gap between having children, and it gets overwhelming. They have a small infant, they realize, she realizes she's pregnant again. So maybe 15 months after the birth of her first child, she might be, having a second child. So we need to have a social support for the women, not only societal but also from the family. And it's important for the healthcare providers who are not trained, who's like, I'm not a trained psychiatrist, but I think everybody needs to know, how can you pick these warning signs? Because a stitch in time saves nine, and then refer the patient, the woman, and reassure her, her relatives, that you cannot ostracize her. That's another big issue we face in so many parts of India. Women are ostracized.
Dr. Murthy, the first contact in the particularly in the villages. I was born in a village, it's in
Hmm.
the home. First contact a woman have is the midwives, the Anganwadi workers. Or they are the ones need to be educated. Are
Yeah.
we? I think it is a great idea to provide a lot more resources for them. And I really made a story recently. I presented a story about a woman who delivered in southern India, Telugu woman, 15,000 babies, particularly in Adivasis community, which is a scheduled tribes with untouchables and all those
Hmm.
people, that she delivered 15,000 babies. It is really that we need to provide resources. She got the Padma Shri award actually, but she got the highest civilian award from India. But that they should be recognized everywhere, and then we need to provide much more resources and much more, the financial resources and all the other resources need to be provided. Do you agree? What is the role of the because we cannot afford psychiatrists even in this country now.
Yeah.
So what kind of the resources, what kind of a role midwives can play and really can be effective for these women?
Thank you. Bring up a very important point, because midwives are very crucial. We cannot do without midwives. They are like really the eyes and ears of the community, and they're the eyes and ears for the physicians because they are the ones who often are the first, line of contact, as you mentioned. So they need to be taught to say, and they can, because based on experience and because they have the personal touch, a woman may be very comfortable talking to the midwife whom she sees, to say, especially after her delivery, I'm not okay. I mean, my mood. So, and then it's up to the midwife to realize that she needs help. So, again, it's a societal support. And also, as you say, to nurture this relationship between the community health worker, as you said, the Anganwadi, where they, take care, or the midwife or the community health worker, and the women. And also, if she tells somebody at home, it can be her mother-in-law, her sister-in-law, her mother, or they cannot dismiss this and say, oh, she's crazy, because that the social stigma. So it's, best is to talk about it. And I just want to give a parallel example. The former ambassador of Suriname to the UN, I've had the privilege of knowing him and working with him, Ambassador Henry McDonald. he was the one who was behind, when Ban Ki-moon, the former Secretary General, announced the he for she movement, where men stand with women. It's a big campaign. Your listeners can Google like he for she. And then Ambassador McDonald was instrumental in having barbershops, men in barbershops talking about violence. So you see, reaching out to the grassroots. So the same thing, maybe we could use that, like in India. I'm taking the example of India because you brought this up. They still have plays. You have all these people performing plays. So talk about mental issues, especially puppet shows. So it's just not Twitter. I'm sorry, it's called X now, or Instagram or Facebook, and nobody's paying me to talk about that. But I think similarly, we need to make use of the media, the communication we have in the villages in India to get the message across and have men involved, whether it's the village head, because Ambassador McDonald could do it with the barber shops. This is a great initiative. So maybe there's something like this where we can talk about women's mental health.
Love that, he for she. Let me. That's a great message. Let me ask you. The question is sexual health. A little bit change the topic a little bit about this.
Mhm,
The pro. I was talking with Salami Myers from a cancer advocacy from group from South
mhm,
Africa. She was
mhm,
mentioning about HPV vaccines.
mhm,
Cervical cancer can be preventable, but
mhm.
there is a because of the sexual encounters and the prominence of multiple partners, whatever the reasons are, that can be preventable, but that is not. HPV vaccine is a globally, it is a big challenge sometimes to get the access to the HPV vaccines. Tell us a little bit about that. What is your view on that?
Actually, HPV vaccines, they're really making good progress. And Amber, American Medical Women, we've been very involved. And one of my friends and colleagues in Canada actually lobbied to have a HPV National Day in Canada. And even in India. Now, the problem is the cost. You see, even before here, the insurance company always did not pick up the tab. Later on, it changed. But the cost is the problem, because they're very, I think Merck, as far as I know, I think is one of the very few ones making the Gardasil, the HPV vaccine. But again, it's education. And that's why I bring up the policy, because I've worked for so many years, in policy. I'm very, we need to bring it, like we have the necessary immunization schedule. We need to bring HPV in also into India. You give this vaccine, you give the tetanus vaccine, you give the MMR vaccine, you give this vaccine, that vaccine. You need to include even this HPV. It can be given to young boys and young girls. Now, there needs to be some way the cost can be offset.
Let, let us talk about
I
cost. Let us talk about cost. What about that global fund that you get? The George Bush was mentioning that you provided some money. That's what she was talking about. South Africa, so they can use the PEPFAR fund, some of the global funds. So tell us, what is there any funds available for World Health Organization or any other global organization?
No, first of all, World Health Organization, you need to understand, is dependent on the donor funding from the countries. And they can make recommendations, they work with them. But again, as far as I know, I don't know if there's a specific fund like that, like Gavi for cervical cancer.
Yeah.
There is Gavi, but I don't think cervical cancer is included in the list. So maybe by advocacy and lobbying, and maybe each country could include it in their national immunization program,
It says that
because
they included that. She was saying that is included
yeah,
actually.
but I was talking about India. In India,
Yeah.
it's not included. I wasn't talking about South Africa,
Yeah.
because we are discussing the context of India,
Yeah.
and India has a very high rate of
Yeah.
cervical
Agree.
cancer. And I can tell you why, having worked there, the women do not come for regular pap smears.
Mm.
They come very late. It is so sad. what is preventable. And I was talking to another colleague who is a physician here from India, and he was saying the same thing, because when he had gone to India, and then he was talking to one of his colleagues who's the chief of surgery in one of the hospitals, like, why are women coming in such advanced stages of breast cancer? The same thing, it's shame, like, here we go for a mammogram, you go for a pap smear. It is not that. And we were saying that, like, these women can afford it, they don't mind spending thousands on like new clothes or jewelry, but a fraction of that it can be used to go for testing. Yeah, but definitely, women who are in the higher socioeconomic strata, who are more educated, do go for that. But the problem is the women who cannot afford it, and the women who can afford it, but are not thinking it's so important, because they'd rather spend the money they have instead of going for a pap smear or a mammogram or something else. So again, the whole thing is getting the message across. That's why I said health literacy early on, just to recall, because health literacy is also increasing awareness. In addition to access, we need to increase awareness.
Dr. Murthy, that is, you mentioned the technology. I'm going to present a technology that can reduce these costs quite a bit. I'm going to talk about a technology. After that, I come back and ask you your contribute. What are the things that you do for the global health and your combination? Let me bring you side. Then we'll talk about technology, your technology also. You can jump in anytime. This is about a Raman, the man who is revolutionizing healthcare from the heavens. I'm going to explain how the physics of the technology is changing the world. So let me so you can make any mention anytime, you can jump in. Roman applications in healthcare is drug efficacy, cancer diagnosis, nanomedicine. All of them are clinical biology. It is a truly revolutionizing the healthcare. People don't know, even Indians don't know about him much what he did. Why sky, this is actually physics a little bit. Why sky is blue? The 5 year old questions. Are you smarter than a fifth grader? There's a program, redneck comedian used to do that. Why sky is blue? It's not that simple as you think. It is a little complicated than why Washington is a blue. This was actually figured out by this is a this is not the reflection of the sky coming there, because it is actually a scattering called a Rayleigh scattering. Lord Rayleigh invented it, discovered this Rayleigh scattering. There's the atmosphere in the dust particles, the nitrogen, all those things in the atmosphere. When that's a frequency that the wavelength matches the wavelength matches the dust particles from the coming from the sun. As you know, the white light has all the combination of red, green, blue. All of them are combination comes there and hit the blue light. That particularly nitrogen is a lot. The wavelength of the dust particles have the wavelength of the blue color. So they reflects all of them. It scatters across the sky. That's why you see the blue color there. But what that is called a Rayleigh scattering. It completely scatters the light. But there is another light that is what the Raman found. That is called Raman scattering. While Raman was traveling to England to India, he found out the ocean is blue. It's not he realizes that it's not a reflection. There's something going on in the water the particles molecule itself. That is what he in 1921, while he was traveling, he came back to India, and then he discovered this is called a Raman scattering. Raman scattering is 1 in 1 million photons interacts with the molecules that scatter. Usually 99.9999% of the photons reflect. Complete reflection is scatter complete 100%. But some 1 in 1 million, they will absorb, and they absorb, and they give a different photon, different energy photon. That is a Raman discovered that. What it does in biology, it can revolutionize it. I tell you about that in a second. So when it interacts with it, it is actually can gain some energy from the molecule, or it can lose the energy. So the outside the outcome of the photon coming outside has a different energy levels. From that energy levels, you can detect a lot of pathologies. In fact, that's what. So Raman scattering was validated by immediately in John Hopkins by the another physicist Robert Boyd. He actually validated it, and then he was awarded the Nobel Prize in 1930. He is the first guy to award the Nobel Prize in the 1930. I'm going to play a quick video about the Raman effect, Raman scattering. It will explain to you a little bit about that. Just let us watch that.
His name is Chandrasekhara Venkata Raman. He was born in Tiruchirappalli, state of Tamil Nadu, India. His name is long with numerous alphabets, but get used for it, because the next few decades belongs to this man. He is descending from heavens to destroy cancer. Just not cancer, he is omnipresent in every field: science, medicine, technology, engineering, and even theology. Welcome to the world of Raman gadgets. Raman probe. Point Raman probe to anyone and just click flash, just as you do on your phone. It gives instant result that person has a cancer or not. No elaborate testing, no other diagnostic testing required. Cancer detection in seconds. Raman pen. Raman pen, point and click at the finger and tell you the blood sugar levels instant. No more shedding of blood drops by millions of diabetic patients. Raman scanner. Just place your hand gently on the Pharmanex Raman scanner. It gives you the fruit and vegetable intake and in correlation with the antioxidant activity in your body. By monitoring antioxidant levels may help you to prevent some diseases. Raman inspector. Raman inspector, a handheld instrument, is an invaluable tool for law enforcement. Just point and click, it identifies the counterfeit drugs. Just point and click and can tell you it is a cocaine or any other illegal substance on the spot. No labs, no other testing required. Just point and click and can tell you right there if it is a hair gel or explosive material in the container without opening it. Raman reporter. Just point and click and instantly tell you if that is a true Picasso or not. No other verification required. This is done deal. It is just taught. Raman optical tweezers, Raman microscope, Raman true narc, Raman imaging, Raman hyper, Raman transition, the list goes on. His name is truly omnipresent. This is not a science fiction. This is an extraordinary brilliance of a strikingly tall and dark handsome man from 19th century India. Hello, my name is Ramana Anamaraju and I have a passion for physics, specialized in allied healthcare and above all concern for all well-being of humanity. Sir Chandrasekhara Venkata Raman, usually referred as C.V. Raman, was born in 1888 near Chennai, India, and died in 1970. He discovered groundbreaking quantum phenomena in the field of optics while he was working as a professor of physics at University of Calcutta, India. He was knighted in 1929 by Queen of England and awarded Nobel Prize in 1930, first non-Caucasian ever to win in the field of science. His discovery is called Raman effect or Raman spectroscopy or Raman scattering, which are named after him. We only see objects, including people, when light falls on them and reflect back to our eye. But once in a while, the reflected light also gives stunning details about the molecular and atomic structure of the reflected matter, like a rotational and vibrational energies of the molecules or atoms. This unique reflection was discovered by C.V. Raman and it is referred as a Raman scattering, along with few other names. With humans, Raman scattering gives exquisite details about the cell structure and its function like no other modality we ever seen before. Raman effect is the only way you can identify rotten apple from real ones without touching, smelling or cutting. This non-destructive method is unique to Raman discovery, so thus makes an invaluable tool in the field of medical diagnostics without exposure to any radiation. A perfect tool for law enforcement without opening containers to check for explosives. A perfect method to check the authenticity of the age-old art without using any chemicals. Raman scattering analyzes vibrational and rotational spectra of the target material by using a non-destructive method. Cancer. At present, one of the most advanced methods of detecting cancer is through positron emission tomography, referred as a PET scan. This highly expensive and complicated equipment occupies 10,000 square foot office building or placed on 18 wheelers. The average cost for this procedure is around $4,000. Imagine exam that combines into a single scan the diagnostic imaging power of 10 PET studies, each measuring an essential dimension of cancer's aggressiveness, metastatic potential, and susceptibility to the radio and chemotherapy at the cost less than $25. Raman spectrometer, uh, handheld Raman spectrometer can deliver that punch with a style. By attaching gold nanoparticles to the cancer cells, Raman spectrometer hunts every one of the cancer cells, identifies them, and kills them with a nano-heated guided missiles. Well-respected magazine Diagnostic Imaging describes Raman spectroscopy, a quantum physics technique puts all preceding medical imaging modalities to shame. Raman, the cancer avenger, descended from heavens to rescue mankind from this fatal disease. Raman puts cancer detection is at our fingertips figuratively and literally. C.V. Raman may be Hindu, but his discovery recanted the rituals in the church that happened centuries ago during early Christianity with stunning details. Santorio delle Peregrina, 13th century historical church sitting near a beautiful Cantabrian mountains in Spain. The church completely lost its original Romanesque mudéjar or brick architecture through centuries of rituals and tourism. It is impossible to recreate the original architecture with all its colors and beauty since there was no historical data available. Raman spectroscopy came as a surprise savior for the church. Raman spectroscopy took layer by layer the centuries of environmental destruction, the dust left by oil lamps in 13th century rituals, natural decay of the bricks. Raman, Raman spectroscopy brought back the original image of the architecture with the stunning details. In recent years, 13th century Pilgrim Church was remodeled to its original architecture with all its beauty and grandeur. Thanks to Sir Chandrasekhara Venkata Raman, a true scientist and a true patriot of India. In the field of medicine, Raman spectroscopy coming with a true revolution. You can literally test for cancer with the handheld instruments at primary care offices or even at boutique drugstores in coming years. By catching the disease such an early stage dramatically reduces the cost of this fatal disease. A man from heaven gave a remarkable gift to humans. I am proud to share part of his name. Thank you for listening.
Okay, that is a Raman spectroscopy.
His name is
Let
Chandrasekhara
me
Venkata Raman. He was born in Tiruchirappalli,
second.
state of
1 second. So that is a Raman spectroscopy. I'm going to finish up in a couple of minutes, and then after that, I'm going to bring Dr. Padmini Murthy to the main stage. So he won the Nobel Prize in 1930. Then now that is a he was the that's why I call him cancer avenger. So he's actually vibrational rotation spectrum. That's what when they interact because of the lasers are invented. The reason was it was not a popular for a long time because the 1 in 1 million photons is hard to catch. So that's now after the invention of the lasers, what it does is that the surface enhanced 1 in 1 million. That's a very tough to catch. That's why what they did was it was not a popular for a while. After the invention in the 1960, the labs in the Bell Labs were invented the laser. After the lasers, that was Raman effect became really revived completely. So the use now is called surface enhanced Raman scattering. They use that. What they do is a layer. They put the gold nanoparticles there on that one. It amplifies the 1 photon amplifies it. So you get if there is a cell acting abnormal, one particular cell, You can see that through this the amplified signal from the Raman signal. That is called a Raman signal, actually. Single molecule. You can pathology, anomaly in pathology, you can figure it out. Can you believe that? That is stunning detail. Raman spectroscopy is going to give us in the future. Is a lot of people are working on it, not except India. We were talking about Dr. Murthy was talking about testing the pap smear. These are the simple tests now. The saliva, they found out the Fujian province in South Korea, Japan. They found out this particular tribe. They are getting this cancer. They found out through the Raman saliva testing, through Raman effect. Raman, just a simply handheld instrument can tell in South Korea. That is Raman spectroscopy application. They are using it right now. They detected a lot of the cancer through that process. Raman probes are all portable. It's just easy to carry. Now the food, actually food content. Now new thing is the food things, actually. A lot of with the Raman probe, you can tell what is contained in the food composition, is any pathologies are there, anything like that. And the Ibrahim from John Hopkins actually use a Raman probe to while he is doing surgery in the real time, can see that the counter, particularly it helps you the identify, the lighten up all the anomalies in the cells. So this Raman spectroscopy is the breast cancer is one of the things that we could use. Eventually, we can give these Anganwadi workers or the midwives. They can do these things. So technology can really take us to the next level. Give a woman to the access to all the mammograms and everything you need in the future. It's really technology can play a role in that sense. So Raman, counterfeit drugs, for example, India produces a lot of counterfeit drugs nowadays. So we can find out counterfeit drugs through the probe itself. Just to flash it, that's it. It will tell you what composition it has. So Sherlock, now Raman probe is in the Mars. It's called Sherlock is the I hope like scanning habitable environmental with a Raman luminescence, organics and chemicals. NASA doesn't know how to give the names, but the Raman spectroscopy they're using to find out the life on the Mars. Perseverance rover is checking on it. So Raman really the another one, the last one I'm going to talk about is theology. There is a something, the cloth they found out 2,000 years ago, that they found out is mentioned about Jesus' wife. So they wanted to check it whether it is really 2,000 years old or not. During the Jesus was alive, this was really written during the time. It was validated actually through Raman spectroscopy. It validated this process. So, but anyway, thanks for watching. This is a really, Raman spectroscopy was one of the people we don't even know India, the people that ask questions. He says, India also didn't know much about the Raman, but he was one of the most significant scientific discovery that is making a difference in the future of the medicine. Is going to make a big difference in the future of the medicine. Thank you for watching. Let me bring Dr. Padmini there. So, Dr. Padmini, you tell us a little bit about your technology, what makes a difference. You see, we are from India. We don't know anything about Raman, Dr. Yellapegada Subbarao, and I talk about these people. That really sad part is we don't even know these people what they did for us.
Yeah, it's not my technology, but I just wanted to say that one of my good friends and colleagues, Dr. Amy Ansel, and I, we worked on this book, Technology and Global Public Health. And it was interesting because we had people, contributors from 10 different countries. We had students too. And the whole premise why we put this together is how can there are so many innovations, and I'm sure if we do an update for this book in a couple of years, we'll be focusing on other revolutionary innovations like excuse me, AI, which are there. But one of the whole things is we looked at how can this help women, and there are even technology, for example, which can help gender-based violence. And there's technology, there are apps, or in India there are so many cell phone users. So using cell phone, and especially now, I was recently in Geneva at the World Health Assembly, and I just wanted to share this technology because they are with the rural villages. There was this person, they are trying to see how can they have people get access to, without internet, like know what's going on. So they are just piloting this project. It was really fascinating. And then there was this lady, actually, Durga Das, who was a former cricket Indian captain, and she was in the US. She went back to India, and now she's working to address water, providing water by using like water from condensation. So what I'm trying to say is there's so much of technology out there, and some of it is so simple, like you wonder, is it there? And you just talked about what Sir C.V. Raman said, and thank you. I didn't even know that he had done so. I was familiar with the spectrometer, but I was not sure about all this. But I think there are so many low cost innovations. Like, when you look at the pap smear, it's saving lives. It's pretty low cost. It can be pretty much done anywhere. So I think this is what we need to focus on. And then when we are even looking at, again, I will come back to the advances of vaccines have been invaluable in saving lives. When you look at smallpox, how many lives it killed, how many lives it took. So I think low cost technologies are here, and that's why I think we are having so much of AI, um, working to look at the different aspects of technology. And I still think, even you were talking about this, even like today, what fascinates me after so many years, that with a drop of blood, you can get the whole picture of a person. That is technology.
The pap smear, for example, you give the example of pap smear. If we can do the fast, immediate, right there on the scene, on the go, that instead of sending to a lab and get the results, if we can do rapid testing on those things, it is really makes a difference in the people's lives. So we are really the when I say technology, it's a science, really the science of these people, like the 19th century, 19th century physicists like C.V. Raman, Yellaprakada Subbarao, all those people who did that, really, they science is the fundamentally behind this, and then we are using the technology as a great tool to enhance that kind of thing and give access to the people. That is our goal. Tell us a little bit about your that let us talk about the antibiotics, why that misuse of antibiotics in those countries, and there's a lot of these resistances coming up. Tell us a little bit about that, if you don't mind.
Yeah, like as we're wrapping up, I think thank you for asking that. AMR, as it's called, antimicrobial resistance, is one of the top public health challenges. And according to a report released by the World Health Organization just a few years ago in 2019, 2020, AMR was responsible for 1.27 million deaths globally. And also contributed, it was directly responsible for 1.27 global deaths in 2019, which is not a small number. And again, one of the other problems we have is when I was in Geneva doing Walk the Talk, they have that annual walk and run. I met these two ladies whose leg was amputated as a result of AMR, and she was from Europe, and she said it was not diagnosed till it was late, and she literally said, I had flesh eating bacteria. So what I'm trying to say is, one of the issues are, it occurs in so many countries. As I just said, this poor lady who lost her limb was amputated. She was from Europe, so that's one of the higher income countries. But unfortunately, it has known to affect people in all regions, all socioeconomic strata. But unfortunately, AMR has been exacerbated by inequality and poverty. And also, it's putting a lot of the modern medicine gains at risk, because after surgery you do the surgery, but if your patient is infected and then there's AMR, it's very hard to save the patient. So this is an acute crisis, and not only is it causes death, but it also causes disability. Like this lady I was referring to, she has an artificial limb. So look at the disability. Look at her disability adjusted life years. I mean, it is so sad. And the other thing is, we all love numbers because numbers give us pictures. So I just want to talk about this. According to the World Bank, right? They estimate that AMR will result in additional healthcare costs of 3.4, between 1 to 3.4 trillion dollars by 2050. That many losses. So it's terrible. And by 2030, it says US 1 trillion to 3.4 GDP losses per year by 2030. This is terrible. 2030 is around the corner. And also, they say by 2050, in addition to this, you could have $1 trillion more of expenses in healthcare. So, what do we do? That's why it is the, like the tsunami just waiting to explode. It's already exploding. And on the 26th of September, during the United Nations General Assembly, the high level meeting is there about AMR. So to come together to see what can be done. And as you said earlier, one of the indiscriminate uses of antibiotics, and in so many countries it's not regulated. Like you could just go to a medical store without a script from a physician or a nurse and just pick up an antibiotic, like if you have a cold. So all this is contributing to, and unfortunately, the way the bacteria gets resistant to these, we cannot develop drug resistant, we cannot develop the bacterial resistant drugs as fast. So it's a major challenge we are facing.
In American perspective, I've been here 40 years. I can tell you, it's a global health. They used to think that somewhere there in other countries is not our problem. But in fact, after the COVID, we realized that the global health is our problem. It's a local, there is no global, there is no local health. They're all interconnected. All the diseases can be, transmitted through different mechanisms, the global economy. Let us talk about that. Everybody is talking about global health means somewhere is there. It's actually is a local. Do you agree with that? And can you explain a little bit about that, if you don't
Yeah,
mind?
yeah. As we're wrapping up, yeah, definitely global health is because this is a world without borders. What happened, for example, let's go to COVID. It's not that I'm bringing it up. COVID started in China, but it spread all over. Like I always tell my students, we need passports and visas to travel, but diseases do not. So the downside of globalization is the spread of disease. Now, everything is not pessimistic. The upside of globalization is we can share, we know what's happening when there is a sentinel, we call it a sentinel, event, like there's something, it raises a red flag because of globalization. We can address it because we can resource share, but we need to be very careful because that is one of the issues we are facing is right around the corner, is antimicrobial resistance. And also, it's just not only resistance to bacteria, it's resistance to fungi. And then we have the multi drug resistant tuberculosis. I just want to talk for 1 minute as we're wrapping up. My eyes are on the clock. Is that one of the major challenges we have is this is so virulent, it can spread. And TB is not, as you said, it's just not a disease of those countries. It happens everywhere. That too, when people have HIV, we have seen that HIV and tuberculosis can coexist. So when you have these infections which coexist with the AMR, it gets worse. And drug resistance, and unfortunately, according to statistics in 2022, that is just 2 years ago, only 2 in 5 people, like means out of every 5 people diagnosed with drug resistant tuberculosis, accessed treatment. So you see, this is a major challenge. Not only is it economic burden, but it's also affecting the social structure. So it goes much beyond just the disease, and it can become a chronic disease, which it has become. That's a major challenge.
Dr. Murthy is available on minimurthy1234 @gmail.com or Padmini Murthy at .md.com. She's available. She for consulting, for the global consulting on all the other anything the advice you need or education you need. And she wrote 4 books. And then we need to check on that. It's a totally privilege to talk with you, Dr. Murthy. It is a particularly, very personal to me. You're from my home state, and then your grandfather is one of the well-known, respected figures in the world, in India particularly. So it's a truly privilege and honor to talk with you. Thank you so much to talk with us.
Thank you so much. Have a good evening, and thank you for all the work you're doing. Bye.
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 Retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it